Welcome to the Internal Medicine Clinic at St. Augusta Hospital in Düsseldorf, specifically to the Endoscopic Diagnostics Department. I'm happy to introduce you to our department and take you along for an examination. Here in front of you is the room for endoscopic diagnostics. This is a multifunctional room where we perform gastrointestinal tract examinations, endosonography, internal organ ultrasounds from the inside, and ERCP. This is a special endoscopic tower, meaning we don't actually see the diagnostic instruments themselves right now, but we can see their technical components. All of this is high-tech equipment. All our devices are the latest generation, the most modern ones available on the market for endoscopic procedures. I would like to draw your attention to the documentation center, where we can immediately print and process comprehensive medical reports and diagnostic findings. So, if patients visit us several times a year or regularly, every 1 or 2 years, their entire medical records are readily available for our use. All diagnostic procedures are possible in one single location. And this is the second endoscopy room with the same functionality as the room I just showed you. Let's move on. I'd like you to meet my colleagues who are working here with me. This is one of the most important endoscopic rooms. This is where the instruments for examinations are prepared, cleaned, disinfected, and dried. And here we also hold a leading position, adhering to the highest standards in terms of processing and sterilizing endoscopic devices. This is Mr. Jansen, one of the staff members in the endoscopic diagnostics department, who is responsible for ensuring the devices are in the excellent condition seen here. You can take a look. These are the washing machines for the endoscopes. And I'd like to repeat once more that we guarantee the highest quality of cleaning and inspection of the devices. Please come this way, this is also important. This is where our most prized equipment is kept. These are the endoscopes. Many of them are currently in use, otherwise the cabinets would be completely full. So there are many examinations taking place at the moment. Let me demonstrate one for you. This is an endoscope with the highest possible sensor resolution available today, which is used to perform the examination. Here you can see an additional specialized room for conducting medical examinations. This is one of the primary rooms used for ultrasound imaging and diagnostic sonography. In this space, as you can clearly see, we also have state-of-the-art, high-quality medical equipment and a fully integrated documentation center. This is the third multifunctional endoscopy room. I'd like to show you the inside. That means we're going in. Over here you can see another full endoscopy tower, which is the device where the processors are and the endoscope is attached. This is, for example, a device for examining the intestines and stomach. This is the bed where the patient lies in a medically induced sleep, so the patient is asleep and doesn't even notice the examination. And as you can see, everything is of the highest quality. The equipment, the screens, the processors, and absolute cleanliness in the examination room. The best thing about this room is that a patient under general anesthesia can have 3 examinations performed simultaneously: gastroscopy, colonoscopy, and internal ultrasound or oral endosonography. And since we're truly professionals in this field, as I said, we perform about 10,000 examinations every year. The duration of all 3 of these examinations takes less than an hour. This is the second room intended for ultrasound or sonography. That means, look, here you can see part of our team at work. This is one of my senior physicians, Dr. Huensgen. And here is Ms. Meyer, she's peeking out from behind the screen. Good day. They are currently busy performing a diagnosis. This office is of fundamental importance to me as a hepatology specialist. Here is the so-called FibroScan, an essential part of any liver disease diagnosis. I'd also like to show you here. You can take a much closer look at this. This FibroScan is a very important component in the accurate diagnosis of liver diseases. Please note, this is a sterile recovery room where patients wake up after procedures. This is very important for the patients. And here we come to the final part of the endoscopic procedure. In this specialized room, patients always feel very comfortable. They are kept under constant expert medical supervision here, from the diagnosis until the moment they finally wake up. We are very respectful of our patients' personal privacy, providing them with the most professional and compassionate care possible, right up until the moment the patient is fully conscious. I would really like for us to take a walk through here. Take a look. Here we have 6 beds, a private toilet, and a secure safe for your valuables. And here you can see how we monitor the patient's condition. This is what it looks like. We continuously monitor and track the pulse, blood pressure, and heart rate. And patients stay here until they have completely and fully recovered from their procedures. The staff at Deutsche Klinik Allianz know our internal routine very well and dedicate a significant amount of their time to the patients in this ward. There are also patient restrooms located here. Now we're approaching the final room of the endoscopic diagnostics department, which is actually where a visit to us begins. This is the reception desk. Let's take a look. These are my team members. Allow me to introduce them. Ms. Wilhelms and Mr. Robin. They work in my department. This is where everything happens that keeps the other rooms busy, and we always have a high volume of patients. If a patient needs to stay in the hospital, for example, after a complex exam, after removing large intestinal polyps, or to further clarify an oncology diagnosis, in that case, we accommodate them here. I'd be happy to show you the wards for inpatient care. We'll take a look at what the unoccupied rooms look like. This is a classic single occupancy room. We also have the option for double occupancy, for example, for relatives or those close to the patients. So we are in a private single room with a wonderful view from the window, with a very functional and tidy bathroom. It's very nice and clean here. It often happens that patients have to stay in the hospital, and they really like it here. Next, I would really like to show you the guest room of our private ward, the so-called lounge area, which is very well prepared and equipped for visits from your guests and relatives. Here you can chat with your loved ones, enjoy a cup of tea or coffee, or wait for an upcoming exam if you don't want to sit inside the ward. Here is the outpatient section of the endoscopy department, which I'll briefly show you, especially this office. This is where the reception and my secretariat are located. Allow me to introduce my secretary, Ms. Dunn, who has known my Russian-speaking patients very well for a long time. So patients come in here with colleagues from Deutsche Klinik Allianz, they are received here, and then we go straight to my office where, with the help of an accompanying interpreter from Deutsche Klinik Allianz, we talk with the patient about their symptoms, treatment wishes, diagnostic duration, and so on. All of this happens here. Take a look. So then we can take a look in here. Yes, and here is the office, okay?